Today I have my patient here, Candace, and she has significant problems breathing through her nose. What I would like to do today is talk to you about the use of LATERA, which is a product from Spirox, which can be placed in the lateral wall of the nose to aid in lateral wall support. When she breathes in, she has difficulty breathing through both nostrils. And so what we typically do is we'll put her head back here and I'll watch her breathe. And what you see here very clearly, breathe in again, is you see this whole sidewall of her nose move medially. And what that means is there's weakness in the lateral wall, it's collapsing into her airway and blocking it. So what we're going to do today is basically insert LATERA, which is going to go in here in a subcutaneous layer deep over the bone to about this point. And what that's going to do is cantilever off the bone and basically create support to the sidewall and improve her breathing. So I can go ahead and I can place this right here, going at an angle again towards the septum. I'm controlling this as I advance it. I'm going to move up, and as I move up, you can kind of watch where that is going. And here I am, up in this area. I'm making sure I'm in the proper depth so we don't see this. And then I lift that little edge up, and I can see the point right there. Then, come back here. I'm going to keep my traction down. You see I'm pulling down, deploy the implant, and then pull back. And that allows me to keep the implant in proper position here and allow me to support that sidewall. Okay, so now when we look, we're going to have Candace breathe in, and you see this side of the sidewall that was collapsing in is no longer collapsing. Breathe in. How's your breathing?
Improved.
Yeah, so now she has good support along the sidewall. LATERA is coming down off the nasal bone, cantilevering, supporting the sidewall on both sides.
I was completely back to normal and had no limitations other than the fact that for the first several days you can't blow your nose, and I would say the first 24 to 48 hours it was a little bit swollen, and no one that knew me noticed anything terribly different.
Did you do anything activity-wise that you noticed an improvement in your breathing?
With jogging, I noticed that I had a little bit more endurance. I didn't feel like I was struggling as hard to breathe through my nose, and I felt like I had a little bit more stamina as a result of it because my nose wasn't closing while I was running and breathing, and so I was able to get more air.
Okay, great. Let's just look at your breathing one more time. And then just go ahead and breathe in. And I don't see any movement in the sidewall. And it's as if I was supporting it.